contaminants in the room and they are deposited on the gadgets and other office equipment. There are some high efficiency particulate air filter machines, and this can help to clear these viruses as well. The only challenge here is that most of our hospitals and our scanning centers have the closed loop air conditioning system without the filter. So it's important that we aerate the room. A single air change can remove as much as 2/3 of all airborne contaminants in a room. So as much as we may enjoy the air conditioning units and the climate control, it's important to open doors and windows of our ultrasound room every for about 5 to 10 minutes every hour when we are scanning, so that we can aerate the room and ensure air change. In terms of the setup itself regarding the ultrasound machine, some ultrasound machines have the capacity to accommodate 4 to 5 probes all connected at the same time. But as long as the COVID pandemic lasts, it's important that we only connect the probes that we are using. If you are not using any probe frequently, for example, if you have a transfontanel probe or you have a linear probe and you are not using them frequently, let's disconnect and tuck them away, leaving only the transvaginal probe and the curvilinear probe that we use frequently. Again, whatever device or accessory that we are not using frequently in our ultrasound room, we should aim to take them away so that they don't serve as potential reservoirs for contaminants. It is difficult to clean furniture that are fabric covered. So if we have fabric covered furniture in our room, we should aim to change them to those with hard surfaces so that we can wipe them properly. The bedspread, the linens that we use, it's important to replace the washable ones with the disposable ones. Interestingly, even before the pandemic, this was standard practice in the UK and the US, and the linens are just disposable. So once the patient stands up, we fold it off. They don't use bedspreads. And this is what I hope that many of us will be aiming to follow in our practice presently. And I've only made examples of the UK and the US because that was in the pre-COVID era. But even in Nigeria, these disposable linens are available and we can easily get them. They are cheap. It comes at a price that is readily affordable for each patient. So that's my ultrasound room there. These are some of the disposable linens. And that's my ultrasound room. That's one of them in use. It's very hygiene compliant, and you can readily dispose of it once the patient stands up, clean the couch before the next patient, and lay a fresh one for the patient. So besides US and UK and other European countries, even in Nigeria, I'm aware of many centers that are doing this, and I hope that we will follow suit as well as we aim to improve our safety precautions in the COVID era. In terms of conduct, I think the most important thing for me to say here is that we need to reduce discussions and talking while we're performing the ultrasound scan. It's very important. So if you're scanning a pregnant woman, you may need to obtain history. You want to know about the LMP or whether there has been any background risk in the pregnancy. Please obtain all your history before you start to scan. Have everything documented before you start to scan, so that when you start to scan, there is very limited discussion between us and the patient. The other thing is that we must use face mask. It's important. We're going to review recommendations on face mask in a minute, and the patients should also be masked. My experience so far suggests that some of the public hospitals are able to enforce this. Unfortunately, the private centers are not able to turn back patients that are not masked. So it's a difficult balance. A woman comes in, she needs a scan, she's not having on face mask, she's brought money in to pay, but we have to consider the safety of everybody as well. So it's very important that we insist that these patients should have their mask on, and we will review the recommendations on that in a minute. With respect to teaching, this is another high-risk activity. So if you want to teach, please store the images, and you can project them on a screen and review later rather than teaching while you are scanning. And that's because it's very easy to generate aerosols, and these aerosols can transmit infection from the patient to the ultrasound practitioner, or from the ultrasound practitioner to the machines, and we don't want this to be happening. So these are some of the non-PPE mitigating steps that I think we can take. Next, we will move on to the personal protective equipment. I'm sure a lot of us are familiar with. We are professionals at this, so my job here is easy. All I'm just going to do is review and revise the available evidence with us. The latest guideline is from WHO, just about 10 days ago, and I've divided this into two. The first one is for health workers, and the second one is for patients. What should we be doing as health workers in terms of face masks? So this is the WHO advisory on face masks. So in terms of face masks, health workers in health facilities should use medical masks. That is the advice for ultrasound scan and where you cannot ensure the distance that is recommended. So when you are doing your routine activities, you should use a medical mask. And by medical mask here, we're referring to our usual surgical mask. So as ultrasound practitioners, we should use this. What about the patients? The recommendation at the moment, the Nigerian recommendation, is that the patients, we are adopting the principle of universal masking. That is the federal government policy presently, universal masking. And by universal masking, it means that everybody in public places or when you're coming in contact with somebody else will have to use a mask. So even when the patient is not a COVID patient, the patient should still use a mask. What kind of mask should they use? In most settings, the patient should use non-medical mask, and that's a fabric mask. Again, WHO has discussed further what a fabric mask should be. 3-ply mask with cotton and intervening material, we can always look for that. So while the ultrasound practitioner uses a surgical mask, our patient should use a non-medical mask. However, if the patient has any symptoms that may suggest COVID, then for the purpose of source control, the patient should also use a surgical mask. That is the recommendation. And this recommendation, has, apart from WHO, has also been adopted by ISWAG as well. Now, this is a summary from ISWAG safety statement on COVID, on what we should be doing. So if we have an asymptomatic patient that is TOCC negative, and this is travel, occupation, contact, and cluster, as I discussed earlier, what we need: hand hygiene, surgical face mask, disposable gloves. At the moment, some other organizations also recommend impermeable aprons. For baseline, the patient does not have any identifiable risk. So ultrasound practitioners, face masks, hand gloves, impermeable apron, good hand hygiene. If you have dedicated work clothes, that's fantastic. But if the patient has a risk, then we should be using the respirator mask, N95 or fitted FFP2 mask if the patient has a risk. Face shield as well as hair cover and double layer of gloves. we must consider this. And the same recommendation is what we'll do when the patient has suspected or confirmed or is confirmed to be COVID positive. So for baseline, this is the recommendation here, but the moment you suspect any risk, for suspect and for confirmed cases, the precautions are the same. In terms of cleaning, the best guidelines come from the CDC recommendation of 2007, and it was updated in 2019. And there are two recommended steps, cleaning and disinfection. Cleaning is very important because it removes all the visible dirt from objects and surfaces, and it makes disinfection effective. So if we don't clean properly, disinfection becomes less effective. So the CDC recommendation is what we will follow. ISWAG and RCOG and WHO have adopted the CDC recommendation actually. And what does it entail? The first step is to classify the equipment we want to clean. And the standard for now that is used globally is the Spalding classification of medical devices. So in the Spalding classification, the devices are divided into three: non-critical, semi-critical, and critical equipment. For equipment that come in contact with intact skin, these are classified as non-critical equipment, and the abdominal probe falls under that category. For our transvaginal probes, those are semi-critical equipment, and they should undergo high-level disinfection, while the non-critical devices should undergo low-level disinfection. It's important that we stratify our equipment into this so that we know what the appropriate thing to do for the equipment are. So in terms of the abdominal probe, the first step is cleaning, and the second step is low-level disinfection after each use, and we'll be fine to start scanning the next patient. And many of us may not know that a lot of the probes are water pliable, so it's possible to clean your probe. You can wash it with running water and soft clothes. This is fine and safe for the probe. We can also use some detergent wipes. But if we want to use detergent, please let's know that the detergent should not be those that are abrasive, as these ones may damage the windows of the probe. The good thing here is that the coronavirus is an envelope virus, and as such, it is easily destroyed because the layer is easily disrupted by soap and detergent. So we have agents here that can readily deactivate the coronavirus and many other viruses. I've listed them here. This recommendation is adopted by WHO, is adopted by ISWAG, and it is also adopted by CDC. So whichever of these we're able to get is good for low-level disinfectant for our abdominal probe. Clean air wipes are available in Nigeria as well, so we can order for this and we can use them for abdominal probe. And with a contact time as short as 1 minute, we are good and ready for the next patient. Vaginal probes must be covered before we use them, and after use, dispose of the sheet. But even after that, we need to do high-level disinfection, because if we remember the Spalding classification that I discussed earlier, the vaginal probe falls under a semi-critical equipment. And again, these are some of the agents that we can use for high-level disinfection. Glutaraldehyde 2.5% is readily available in Nigeria. The low concentration sodium hypochlorite and hydrogen peroxide are available, and we can get some of this and use for our transvaginal probe. I must sound a note of caution here. What is very important here is we need to know that some of these machines are sensitive, the probes, and you must contact the user manual to know which is the best one. One umbrella does not just fit all. Household bleach is the most readily available here, and that's why I'm talking about it. Please do not use the household bleach because it is too concentrated for the materials that are used to make the probe and can readily damage it. When we have a suspected case, the best thing is to use a mobile scan and scan the patients in the room. A negative pressure room if it's possible, but we don't have negative pressure rooms in Nigeria. So avoid scanning patients who are COVID positive and need ultrasound scan in the general purpose ultrasound room. The best thing is to have mobile scans and scan them by their bedsides. And whoever is scanning should be carefully selected so that those risks that we discussed are not there. And you should remember the PPEs that we spoke about: Google face shield, gowns, double gloves, and a respirator mask, N95 FFP3. If it is, however, not possible to scan these patients by the bedside and they have to use the general purpose ultrasound room, it is possible to have a dedicated machines for COVID positive patients. That will be fine. If it's not possible, then do this patient last at the end of the list for the day. We have to deep clean the ultrasound machine after each procedure using the high-level disinfection protocols that I talked about earlier. I have left hand hygiene to the last because it's important. I remind all of us again after this: wash your hands for at least 20 seconds with soap and water. It's very effective. 60 to 95% alcohol. And when do we wash our hands? Remember, before patient contact, after patient contact, if we touch any potentially infectious materials, including the ultrasound machine itself, interestingly, and before donning and doffing PPE, is important that we wash our hands. We can never get too tired of this. And as we do this, let's also remind the patients to wash their hands and to practice appropriate hand hygiene. So in conclusion, I will say that just to remind ourselves, ultrasound services are high-risk procedures, but they are essential. Decisions have to be taken, care needs to be rendered, and the mitigating steps that have been proven to work include hand hygiene, respiratory hygiene, contact, and droplet hygiene. The last thing I need to do here is to advise everybody to stay safe and to thank you for listening to my presentation. Thank you. Over to Dr. Nabudozo.
Thank you very much, Ibrahim. You can all clap for him using your system. So for those who are new to it, just go to reactions, and then you can give him a thumbs up or a clap. So let me see. Only 2 persons are giving him, yes, more thumbs up now. Okay, yes, now people are clapping. Thank you very much.
I think the claps are looking like slap. So are they claps or slaps?
That's fine. I want to thank Ibrahim for his wonderful presentation. Immediately, I gave him the task to prepare. I already saw what he was doing and he was giving me updates. And when I saw some of the slides, I was really amazed. So I knew that today we're in for a great treat. The only thing is just that he spent a little extra time. You know, some of these things, they're extremely difficult to manage with the time because there's so much. You can imagine, mention one quick, I will ask him one quick thing. They just talked about the low-level disinfection for transabdominal probes. And somebody asked, is it at the end of the day or it is after each scan? So you can quickly just answer that.
Low-level disinfection should be performed after each scan, after each one, before you start scanning, and after each scan, and then the last one at the end of the day before going home. It's very simple and straightforward, and it's just 30 seconds to 1 minute if we have the right wipes to use or the right equipment. So after each scan, we do low-level disinfection.
Okay, I really can't see. I know that there will be a lot of feedback, but what we plan is that at the end of the whole presentation, if for those who want to leave, they'll feel free to leave then, and then we can leave the system on, and then those who want to continue discussion they will continue. We are moving very quickly to the next presentation. It's from one of the very big gurus in ultrasound training and
Dr.
teaching.
Nabudozo,
Yes, Ibrahim.
sorry to interrupt you. I'm just having some challenge with my device, so I'm gonna leave and try to come back in. Can you please let me back in a minute?
That's with your slide?
Thank you.
How is it with your slide?
What did you say?
How? With your slide, or because I'm stopping your slide, I've already stopped your slide sharing anyway.
Yes, so I'm leaving the chat room now.
Okay.
I will sign in with another device.
No, you can only sign in. We'll
So
have
just let me.
no, we have a larger. No, no
that.
problem. We have a larger space now. We have about space for almost 500, so you can come back in. All right, thank you. So, as I said, the next presenter is somebody all the way from Egypt. He's probably going to be speaking to us from Egypt. I don't know if he's at night over there now, but he has to stay awake to make sure that he speaks to us. He's one of the great guys. He's Idris Zahidi. He's a biomedical engineer who specialized in medical imaging. He has a PhD in public health management, and he's an advanced clinical applicator, leader for women's health ultrasounds in Africa for GA Healthcare. Let me just state that he's here to teach and not necessarily to. So please, Zaidi, tell us about your machine. He's a specialist in clinical applications, especially in imaging, and has worked with GA Healthcare for over 8 years. It was very difficult for us to get him to make this presentation. And even looking at his slides, I already knew that this is a man who is talking from many years of experience working with the machine. He's to talk to us about optimization, and then he will look at some of the clinical aspects. However, because we have spent a little bit of time, he's supposed to talk to us about optimization, both for general OB-GYN scans and then for Doppler scans. I'm going to plead with him to leave out the Doppler aspect for today. Next week, by the time we finish, we're going to tell you what we have for next week. It has to do with Dopplers. We'll see how he can still come in next week and then talk to us about optimization for Dopplers before we enter into the Doppler presentation for the day. So permit me now to call upon Idris Zahidi, one of the seasoned biomedical engineer and an advanced application specialist, to speak to us. So Idris, you can share your slides now.
So first of all, thank you very much for this introduction and thank you for inviting me. I'm very glad to be with you. As with this corona situation, it's very hard to have face-to-face meeting, and education is still key, and I'm very glad to participate with you to this webinar. So if I understand, as we are missing of time, today I will present you how to optimize your 2D image, and we will keep the Doppler optimization for the next webinar.
Yes, thank you very much.
Okay, perfect. So okay, first of all, as you all know, when you are scanning, the most important thing when you start is the choice of your probe, of course, but the whole ultrasound is related to the frequency. What frequency are we using when you are performing your exam? You know, because ultrasound, they have two features, speed and frequency. Frequency will impact directly your image resolution and your penetration. So frequency have to, either it will improve your image resolution, or either it will give you more penetration. Where you will see later on this presentation that the second feature of ultrasound is the speed of ultrasound according to the tissue, or to the tissue where our ultrasound are going. you will see that you will have different speed, and we will use this different speed in order to improve our image quality. But first of all, what about frequency? So when you use a high frequency, you will improve your image resolution. Okay, and when we will use a low frequency, it means when you decrease your frequency, you will improve your penetration. Let's have a look to this image, for example. You see in this image, for example, when we are using a high frequency around 8 megahertz, we will have here improve the image resolution in the near field. We have a better resolution in the near field. The more I will decrease my frequency, more I will penetrate. But you see here, for example, when I'm really in the far field, you see that here, I don't have the same image resolution as in the near field, which is normal. That's why we are always looking for a compromise or for less compromise between penetration and resolution. For me, this is the biggest challenge of ultrasound today, especially that we have more and more increasing obesity in our population, and that we have, I would say, more and more hard to scan patients with high BMI. So frequency is very important. So when you have, when you are looking at the near field, you should increase your frequency. And when you are looking at the far field, you should decrease your frequency to go deeper on the image. And you know, the choice of the probe will impact also your frequency, because every probe has a specific frequency that depend on the number of crystal, size of the crystal, but also on the shape of the probe. That's why when you are using a linear probe, like in the solution, and you have the same penetration, specific frequency. Of course, when you use the probe, we are sending the ultrasound wave that will interact with the different tissue. The ultrasound wave will come back to the probe, and then we will convert this ultrasound wave, this mechanical wave, to electronic signal that we will send to the beamformer of the system, that will treat with different algorithms this signal and display the image on the monitor. But really, the choice of the probe will impact the frequency, and the frequency will impact your image resolution or your penetration. So at the end, what is a good image? If we look at, it's like an equation with multiple variables. You see in a image, we have the frequency that will play a big and important role in delivering us a good image, the gain of the image, the focus, but also the angle, the depth, the zoom. But also what is important is that the operator and the patient are two elements that are key in the image resolution. And we're gonna see now how all these elements, all these features can impact, and how can we use them in order to improve our image resolution. Of course, the patient, we have to adapt. You cannot keep one preset. You are scanning, for example, you cannot keep the same preset for all your patients. We need to adjust in real time the patient. Of course, we have a pre-saved in all your ultrasound system. You have a pre-saved preset that you can use, but for every patient, we can still optimize a little bit to improve and to get a better image quality and to get more information from the image, clinical information. So these are the elements that we can play with in order to improve our 2D image quality. The frequency, of course, the harmonics, the focus, very important, the gain and the TGC, the angle of exploration, the depth, the dynamic, and the zoom. All these elements can impact your 2D image. Let's start with the focus. The focal zone is the narrowest portion of the ultrasound beam in the tissue. At this point, it's the point where the emitted beam will give us the best spatial resolution. So if you see here, first of all, in this 2D, this image, you see here, we are moving, if you can see really here, we are moving our focus position up and down. And the more I'm moving this, you see that the image quality is impacted. I'm increasing the signal at the level of my focus. Why? Because what is happening is that when I'm moving my focus position, I'm telling to the ultrasound beam to stop here at this position and to give me the best resolution possible. Is that I'm telling to the ultrasound beam to stop at the level of my focus and to the maximum as possible of my ultrasound waves at this specific position. So it means that, for example, I'm doing an exam and I'm looking at the, for example, at the face of the fetus. I should move my focus position at the level of the face. If I'm doing, for example, a femur length measurement, I will have to adjust also this focus position to the femur position. I cannot have the femur here and my focus position down here. I will lose in terms of image quality. So that's why it's very important to always adjust your image, your focus position. The second thing that is really important also is the gain. So the gain, it's a uniform amplification of the ultrasound signal that is returning to the transducer. It means that I will amplify the ultrasound signal in order to have more information on the image. The TGC, which is the time gain compensation, is a local amplification of the ultrasound signal, but in depth. So here on the left of the screen, you can see I have this vascular image where here I have enhanced my gain and here I have reduced the gain. And you see, I don't have always to increase the gain. Sometimes I will need to decrease the gain to have a better visualization. For example, here you see for this I took the example of the vascular structure. I have decreased the gain of this image just to be able to see clearly inside the vascular structure. Also, as I can see very clearly, the intima media here. And you see, because I have reduced the signal. Sometimes I will need to increase the gain to have more signal. For example, when you have a very hard to scan patient with a high BMI, you have to decrease your gain. Why? Because usually the fat give us an amplification of the ultrasound wave. So we will have to decrease the gain to have a better image. When I use the TGC, you see, I can play with the gain, but at different depths. You see here, I'm increasing the gain in the whole image, or I can, for example, reduce the gain and just reduce the gain from up to down or from down to up, according to what structure you want to visualize. Then the angle of exploration here is very, very important. Why? Because, for example, when you the angle of exploration, it means you see this angle. You see here I have a narrow angle, and here I have a much more large angle. If I'm scanning, for example, at first trimester, and I need to have the whole fetus to do my measurement, here I will try to have a big angle. But if I'm always looking at the heart, we need to reduce the angle. Why? Because by reducing the angle, you will improve your image resolution, especially the spatial resolution, and we will improve the frame rate. The frame rate, which means the number of image per second. And as the heart is always moving, I need to have a good frame rate to have the real cardiac rhythm. I need to have a higher frame rate to follow the cardiac rhythm. So that's why it's very important to decrease your angle, especially when you are looking at the heart of the fetus. So reducing the angle to fit only your region of interest will help you to improve your spatial resolution and also to improve your frame rate. So this is, I think, for this presentation about the 2D image resolution, this is the most important slide. You know, when you are optimizing your 2D image, we cannot just come and play. Let's modify the gain. Oh, I want to modify the frequency. Let's move the focus position. No, we have to follow a specific process when you are optimizing your image. And if you follow it, you will be sure that you did everything in order to improve your image. You will have no doubt about that you missed something when you were optimizing your image. That's why the first thing that you have to do is the first thing to do is to change or to adapt your depth. Of course, the depth we will adapt it according to the fetus position and according to the body of the patient. Once you will adjust your depth, then you can move your focus. Because imagine you move your focus and then you move your depth. Here you will have to come back to the focus again, and you will lose time optimizing your image. Same thing with the frequency. As I told at the beginning, the frequency have a direct impact on the resolution and the penetration. It means, let's say you start your 2D image optimization by, for example, let's say decreasing your frequency. So if you decrease your frequency, you will have more penetration. But then if you have more penetration, you will have to increase your depth to have more depth. So that's why if you don't follow these steps, this process, you will be lost and you will play with the focus, come back to the depth, come back again to the frequency, and you will lose time. And you will not see if you are really following everything to improve your image. That's why first thing to do is adjust your depth, then adjust your focus. When you're adjusting your focus, the only question that you should have in mind is what is my region of interest, what I'm looking at, so that I can put the focus position at the level of this region of interest. Then we will adjust the frequency. If I have a need more penetration, I decrease the frequency. If I need more image resolution, I use a higher frequency. I'm done with this frequency, I can adjust the gain according to what structure I'm looking at. If it's bone, tissue, liquid, vascular, heart, brain, spine. So it depends. So here I will adjust the gain. And finally, this is not always the case, but you can play on the dynamic. It means the contrast, to have a more smoother image or a more grainy image according to your eye, because every one of us have a specific eye and have some preference in terms of image quality. We don't have the same expectation. Everyone there is some of us prefer a smooth image, others prefer a more strong image, more grainy image. That's why the dynamic comes at the end. But the first 4 steps are very important, and just please try them and you will see that you can optimize all kind of image just by following this process. 1, depth; 2, focus; 3, frequency; and gain. Why the DFFG? So you can DFFG. You can keep it easily in. Apart from this, what we have seen now, we have all those algorithms that we can play with in order to, this is the second step, let's say it's the higher step. Usually, these advanced algorithms are already pre-saved on your system and optimized. But if you wanna, I'm just showing it to you just because you can sometimes you can use them to really adjust your image as you want. In all our system today, it's in all the systems we have some algorithms that are dedicated for speckle reduction imaging. It means that we will reduce the speckle into the image. And it usually it's by step. It's 1, 2, 3, 4, 5, depending on the system. And if you see on this image, you see that I'm reducing the speckle gradually till, and here I have a very smooth image. Same here, you see that I can have different types of speckle on the image. And how it's working, how the speckle works, how these algorithms in all our system works. It's very simple. At the beginning, I told about the ultrasound wave, and I told you that there is two main features on the ultrasound wave, the speed and the frequency. So we talked about the frequency, and now we're gonna talk about the speed. You know, the ultrasound, when the ultrasound wave will go through the tissue and will go through bones, for example, it will have a specific speed in the bones and then a specific speed in the tissue, and not basically not the same speed. So what this ultrasound system are doing is that in the area where I will have the same speed, I will have the same gray scale, the same gray scale. If I have, for example, 100 meters per second in the tissue and 200 meters per second in the bones. So I will have a different gray scale, and this is how I will have an image that is really close to the real anatomy of the tissue, because I will put the same gray scale, so I will have a smooth image where I will have the same speed. And the more I'm increasing this algorithm, the more I will have a more smooth image and a better also border detection. So that's why the speckle reduction are adaptive algorithms that decrease the speckle, and it will improve the resolution, of course, but also the border detection, as I will have, where I will have the same speed, I will have the same grayscale. So it means that I have a better border between, for example, here the thyroid and here I will have a different grayscale between a vascular structure and the tissue. And we have multiple levels to customize to user preference and image state. So here you will play on the border enhancement and speckle reduction of your image. In all the machine, of course, on all GE machine, you have this speckle reduction imaging software, but also it's present nowadays in all the ultrasound system available on the market. How to then increase the border enhancement? You see here we have talked about how to reduce the speckle, but we have another advanced algorithm that is called cross-beam or compound resolution imaging. It depends on the system that you are working on. But for example, on a Voluson system from G, it's called CRI, compound resolution imaging. Here it's very simple. It's that I will have some cross beam on the instead of having direct beam of the ultrasound wave, I will have some cross beam that will help me enhance tissue and border differentiation, and that will improve appearance of anatomy. Why? Because as I'm using cross beam, I will have, if you look at here, this image is without cross beam, and this is the same image with cross beam, with CRI. As I'm having this cross beam, I'm enhancing, you see here, the border of my arteries. So I'm increasing the limit between the different organ and the limit between the different structure. This is very important in when you are scanning in obstetric. Especially, you have to check if your cross beam is active activated when you are looking at the kidneys, for example, very important, when you are looking at the spine, and also when you are looking at the abdomen or the thorax and you want to see a clear diaphragm. Here, when the compound resolution imaging is activated, it makes it very simple and very straightforward. You just need to check that your compound resolution imaging is activated. The other thing that you can change also when you are in 2D is the color map. Here, it's really you can select it according to your eyes, because every one of us has, as I told you, as I said at the beginning, a different eye. So some of us who are used to the sepia tint, so they are more comfortable with it. And by the way, there is some nice clinical publication that have been done about this topic, and that found that this sepia mode is more easy or more comfortable for the eye because it's more close to the light color. So that's why you have some of us will find this color more easy to use. But this one we will use it especially when scanning for the heart, for example, because it helps us to increase the contrast resolution. So really, you can select all the map that you have on your system. It will not impact the image quality, but it's more according to the patient that you have, to the anatomical structure that you are looking at, that you are looking for example, the sepia for the heart. And of course, it's according to your preference, your own preference. Do you prefer the sepia or another map?
Idris, you start rounding up.
So let me go just to the conclusion. It's really important. Please follow the process that I've just showed you: the depth, focus, frequency, and finally the gain. It will really help you to improve your exam quality and then to improve your diagnosis. And the 2D image quality will have a direct impact on your color Doppler, on your 3D, 4D, and in all other imaging. That's why it's very important.
Okay,
we will see the impact of that on the next webinar on the Doppler quality, and of course on the 3D and 4D acquisition. And thank you. And we will see the color Doppler at the next webinar, as we are short today in terms of time.
Thank you very much, Idris. It's very nice listening to you. So can we please clap for Idris? Thumbs up for Idris, just one person. Ah, Idris, you didn't try at all. Okay, yeah, more. Great. So, thank you very much. What we really find here is that it's a bit tough to take some of this, to finish some of these topics in a very short time. So it's been quite tough. What we're trying to do is to maximize whatever time that we have. So we didn't start recording early, but we have our recordings for some of the presentations today. So we're going to put them on our website. We're going to scroll on that very soon, so people can copy them down and then see how they can go in. Also, just to quickly make some announcements, at the beginning when we planned this whole thing, we thank the committee that worked assiduously to put all this together. I'll make specific mention of one person, Dr. Shile Goshit. He's from Jos, and he has been pushing for this for almost the last 1 to 2 months, and we've been talking and discussing. And then I thank every member of the committee who has worked to make sure that this eventually starts. When we started, we thought we could only accommodate 100%. However, for now, we are suddenly realizing the fact that more people may need to come in, and it's on that basis that we increased the number. So now we have a capacity for 500. So based on that, when we send out the information, feel free to inform your various members so that they are free to join. It's free, and it's being sponsored by ourselves. So we try to look for funds within ourselves and then just sponsor it up. It's all a way of sharing information and knowledge. So for next week, I'm going to share the slide now, some of the things that will be coming up next week. But just to mention that we also plan that as time goes on, if we continue this and we're able to sustain it, we'll see how we can collaborate with some institutions who will give CMEs, because this actually qualifies for CMEs. It's because sometimes it costs a few things because you are collaborating with others. Not everything is entirely in your hands. So it's based on that we haven't done that now. But as we move on, if we think that we're able to harness a few extra funds, we'll try and see how we can approve for CMEs. Also, the way it will go is what we are still thinking about. How do we know those who stayed and all that stuff? So, as I said, we are essentially working on all that, and we believe that as time goes on, we will be able to achieve the various things that we actually plan to achieve. So now, just a few slides to share as we round up. So the next for sorry, just okay. And also very importantly, we'll be having one of our big chiefs from United Arab Emirates, Dr. Thompson, will be speaking to us on fetal Doppler velocimetry. And also, as a prelude to that, Idris will also be talking to us about it. So we expect that we should be able to take make the presentation available by slides. Yes, we will do that. Then thanks, but too concentrated. Oh, well, that's because many of us have just learned scan by saying, teach me how to scan. And many times we have really not learned the rudiment. We must remember that we are practitioners, and sometimes it's important for us to also know.
Welcome there. Swipe partner. Whatever's in your microphone is muted. Okay. Your video is stopped. Tap to read.
So as we end now, I can't see any specific person raising his hand for anything that you wish to say. So I want to thank all of us. We still tried. We've made it in 1 hour 15 minutes. We started exactly at 3. So we're glad, and we hope that we'll continue to make it out. At the highest today, we got close to 110 participants. So we do hope, and we still have up to 90 at this time. So we're really glad that people made that time to join us. We hope it will continue to improve as time goes on. And we ask for your prayers and your good wishes. We're going to be calling upon experts from different parts of the country and different parts of the world for various topics. So for those on our blog, feel free to send us information of what topics you would like us to treat. And then for those who may not be on the blog, feel free to send to our email address as we've already mentioned. I also thank my department, especially my head of department, Dr. Osai and James, and for the Department of Obstetrics and Gynecology, University of Benin Teaching Hospital, that have collaborated to make this a success. Thank you very much, everyone, and God bless us all.
Thank you, sir.
Yeah.
Thank you, sir.
I wish everybody